All wounds generally commence as an acute wound, but the most common acute wound is a skin tear. Any wound that's been there longer than 4 weeks is classified as a chronic wound if it's not been healing in the 4-week period. The most important thing to remember is it's not the type of wound, but it's the type of limb or the patient that becomes a chronic wound. So patients that we see in general practice that don't heal generally have a number of chronic health conditions that lead to the wound being slow to heal. And as we know, the most common chronic wound is a venous leg ulcer. So if the venous leg ulcer does not get managed with compression, it becomes a chronic wound and greatly interferes with the patient's quality of life. Chronic wounds cause pain, chronic wounds cause malodour, swelling, and lead to social isolation and early institutionalisation. The proper assessments are based on international consensus documents that we give freely at the consensus at the workshops. These consensus documents recommend, for example, skin tears, not using steri-strips, managing the edema around the injured site, and for venous leg ulcers in particular, to focus on compression rather than looking at expensive dressings without compression. We look at cheaper ways of maintaining patients' quality of life, and we work on mobilising the patients so that they can continue to live at a greater quality of life. Practice nurses, particularly ones in rural and remote settings, can also develop skills and competencies that are derived from networking with other nurses that share the same problems in general practice. Patients being unable to afford the dressings, looking at the etiology, and learning hands-on skills such as debridement and compression therapy. And it builds their confidence to communicate with their doctors to actually institute changes in their existing practice.